The Evidence for Change program was written into the original Clark Northwest Coast bid as part of the capacity building. At that point, it was called Team CPD. But it's based on some assumptions about that people would want to make changes in their practice. So the people in the NHS and in social care want to make changes in their practice. They might not have the evidence that they wanted to use it to use to make those changes, but that actually if we had them working in teams, it would be stronger and it would be easier for them to identify the evidence they needed and make those changes in health and social care.
Good morning, everybody. My name's Karen Nolan and I work for Blackpool Council as a public health practitioner, and I've been the leader for our Evidence for Change project. You'll have to forgive me because we haven't got this, as Ramona said, we haven't got the screens on this the laptop here, so I've got my mobile, so I'm not reading text messages or on Facebook. I'm just actually trying to figure out what's going on. Okay, so just down as usual, is it, Gareth? Okay. So as I said, I'm Karen Nolan, public health practitioner. We've also got Stephen Boydell, who can't be with us today because he's got more pressing matters that he needs to deal with. And we've got Anna Dootson, who was our assistant head of the Educational Diversity, which is the pupil referral unit in Blackpool. We've got Viv Council-Thomas, who's a careers coordinator, also from Educational Diversity. Does everybody know what a PRU is? No? Okay, a PRU is... Well, Anna, do you want to explain what a PRU is?
Yeah, so PRU stands for Pupil Referral Unit, and there are lots of different types of PRU, but the one in Blackpool, which I believe is the biggest one in the country at the moment, caters for young people who cannot access mainstream education for a variety of reasons, whether that's behaviour or health issues. So that's what Pupil Referral Unit is, yeah.
Okay, and then the final, but obviously not least, member of our team is Fiona Downey, who's the Education Officer for the Youth Offending team. Okay, so we'll just give you a very quick brief overview of the health in Blackpool. Many of you will probably know that Blackpool is a particularly unhealthy place to grow up and to live. Life expectancy is reduced for men and females, but the gap is greater for men. And it's got the highest level of young people who are admitted to hospital as a result of self-harm for 10 to 24-year-olds, and it's actually 3 times the national average. When you look at the posters at the break, I've got a graph on there which shows the rate of increase in self-harm in young people, which is at a considerably greater rate than the national average. And obviously that is a massive area of concern for the public health team, but also for the council as a whole. We've got really poor attainment for GCSEs, and it's significantly worse than the national average. And we've also got above national average figures for young people who are not in education, employment or training. And we've also got a higher rate of first-time entrance to the criminal justice system and teenage pregnancies. We teeter around the top 5 for teenage pregnancies. Last year we were at number 11, which we were quite pleased about, but I think we're back to number 3 now. Okay, so the project focused on working with young people with dyslexia. We know that young people with dyslexia are much more likely to be excluded from mainstream education. We know that they are much more likely to offend and have display risky behaviours around substance misuse and delinquency. One of the original feelings about the project was that a lot of these behaviours are a result of low self-esteem. This is something that we've discussed together as a team, but initially, because I should also add that I'm dyslexic, so if you do spot any spelling errors, please do keep them to yourselves. So yeah, I'm dyslexic, and I've also worked teaching young people who've been excluded from mainstream education, and for me it was quite apparent that a lot of those young people were undiagnosed dyslexics. And also I know that Anna and Fiona and Viv also come across quite a few young people who you might consider to have dyslexic tendencies if they don't have a formal diagnosis. So the intervention that we were going to look at was looking how to consider self-esteem and resilience and how to improve that in young people with dyslexia. The idea being that if they have got improved self-esteem and resilience, then they're more likely to be able to stay in school, so which in turn would improve their educational attainment, reduce risk of substance misuse and offending for that particular group. But also we know that getting a a decent job at the end of their education is key to maintaining public health going into adulthood. So from the evidence, as I said, we know that young men with dyslexia are more likely to become NEETs, abuse drugs and alcohol. There's a much higher incidence of dyslexia in young people who offend, and that's estimated at between 43 and 57% of young people who have offended, and that's compared to about 10% of the general population. We also know that people with dyslexia are much more likely to suffer from depression and other mental health problems. We also know from other research that the substance misuse population has got a much higher, substance misuse treatment population has got a much higher prevalence of dyslexia, and that's estimated to be around 30 or 40%. So it's pretty grim if you've got dyslexia for a lot of people. So the wider stakeholders that we were involving in our research were schools and SENCOs, which are special educational needs coordinators, is that right? Educational psychologists, special educational needs teams, children's social care, criminal justice professionals, Head Start, which is a big lottery initiative to look at increasing resilience for young people in Blackpool, particularly around that school transition from primary school to secondary school, which we know can be quite a difficult period for young people, and also children and young people themselves. I should also add that one of the logics behind this is that we know that young people with dyslexia are subject to a number of health inequalities, and we know that young people in Blackpool are subject to a number of health inequalities, and when you've got that overlap for young dyslexic people in Blackpool, the likely effect of those, the crossover factors, is likely to be much, much worse than just the sum of the two separate parts. So the project has evolved. So initially we were looking at like a universal resilience-based programme for young people with dyslexia. And then we, through our discussions and the work that we've done in the workshops, we appreciated that quite a lot of young people don't have a statement of dyslexia. So we don't know. They're known to have dyslexic tendencies, but they haven't got that piece of paper that says they're dyslexic. So that would prevent them from being part of our programme, and we felt that actually that would leave quite a lot of young people who could do with an intervention outside of the remit. So we expanded it as well from males to all children to be more equitable. There's low levels of identification of SPLD, specific learning difficulty, and we felt that was a real issue. And we also identified through the literature that early identification of dyslexia really does improve outcomes. Young people can get the support that they need earlier on so that they can build those confidence levels, stay in school, and develop coping strategies that don't involve drugs and alcohol and criminal behaviour. Okay. But we also chose to prioritise children with other coexisting risk factors. And what are the, so this is just a diagram that, sorry, I'm just moving because I can't read it. This is just a diagram that demonstrates how the project evolved. So this evolution did delay our progress somewhat. So you can see that we went from young men to all young people, from teenagers to 7 to 9-year-olds, because that's the earliest you can identify dyslexia. We were going to look originally at young people who were already excluded or at risk of exclusion and possibly with involvement with criminal justice system. But then we decided that early intervention was key. So if we got in there before those behaviours were manifest, then we would be able to give young people a better chance. So we were looking at children who were still in mainstream education to identify them before any issues happen. And we also went from young men who are already identified as dyslexic to children with other risk factors for poor outcomes. And one of the, I don't know if I've got a slide on it. No. One of the risk factors we were looking at was adverse childhood experience. There's a whole raft of research about adverse childhood experiences and the impact that can have on adults later in life. For example, people who score more than 5 on this adverse childhood experience checklist are more likely to have problems with drugs and alcohol, suffer depression, smoke even, things like that. So we were looking at, and the types of things that are on this adverse childhood experience checklist are the loss of a parent, a parent who has substance misuse issues, a parent who's gone to prison, that type of thing. So we were looking at identifying and prioritising those children who are potentially dyslexic in Blackpool, but have also got these other factors again, which would compound on their health in the future. So we did experience a few issues. As I said, the evolution of the project and how that panned out did delay us. There was lots of discussion and reshaping and refocusing of the project along the way, which obviously takes time. So it did kind of slow our progress. And then also identification of a suitable tool to identify vulnerability. The Adverse Childhood Experience tool is adult-based, and it's a self-administered questionnaire. It wouldn't have been appropriate to ask a 7 to 9-year-old to ask them if they felt that their mums didn't love them, for example. So it would be, we were looking for an evidence-based tool that we could use to identify potential vulnerability, which we are yet to find. And also there was a lack of a Blackpool-wide approach to dyslexia and SPLD. There was no policy in place. There was lots of children who weren't being statemented because it wasn't felt entirely necessary to statement, because if you could still offer that support, you didn't necessarily need that label. And also we had difficulty engaging stakeholders. Everybody's busy. Everybody is really, really time constrained in their roles now. There's been lots of job losses across all local authorities, and people are doing a lot more in a lot less time. And programmes like this, I think, whilst we all understand the value of it, sometimes it can be very difficult to make sure that other people recognise the importance of this type of evidence-based programme, and also allowing the time for people to be released to do that work. So obviously we had a lack of resources, both time and financial. This was a zero budget project for us. And also the project was quite ambitious. We wanted to completely change the practice in relation to how young dyslexics are identified and supported in school. And it was an 8-month project. Was it from February to, well, this is the last one, was it? It's February time we first met, I think. And also, because ours is school-based, we had difficulty that we had the big Easter holiday and also the big summer holiday, which did limit us. We've got some people in our team who are term time, is that right, Anna? Your term time? Teachers. Well, teachers generally, Ed Sykes, they were the people we were most concerned about engaging for the project. And, you know, there was like 2 or 3 months when they just weren't in work, you know, so that was a problem for us. I do think if the timing had been shifted, but most of the time, I doubt very much that you're going to get many school-based interventions on this type of programme, so it wouldn't necessarily be a factor moving forward. But for us, it certainly was. Because of the changes that were made to the programme throughout the process, we did have a problem engaging our PPI participants, mostly because they kept changing. The scope of the project changed. First it was young people who had potentially been excluded from school, and then it was 7 to 9-year-olds. So it was difficult. We did identify a young person, but then as the project, who could potentially be a really good participant, but then as it shifted, it was no longer appropriate for them to be our person to input. Also, we felt the young people we were trying to engage, it would be really difficult for them to sit through full-day workshops in this very formal setting. It would be quite intimidating for them. You know, they're out of mainstream education, and we just felt it wouldn't be appropriate to put them under that kind of pressure. Also, problems with paying our potential participant, because the clerk have got a very generous allowance for patient participation. But for us and for the type of young people we wanted to work with, or for just generally young people in Blackpool, we felt that giving them a wad of cash was not appropriate, and they would have had a whale of a time, but we would have all felt very guilty about the outcome there. And we did look at teachers as potential participants, but again, the penny dropped that teachers would have been a really good one, and it was the summer holidays, so we were kind of scuppered from that point of view. So we didn't actually engage any member of the public for our project. at this stage. Okay, so in addition to these problems that we've had, by the time when we met with the Ed Sykes, which was in October, Anna worked very hard in trying to get that meeting set up. We discovered that they have already recognised that there's a problem with dyslexia recognition and how the council as a whole approach dyslexia, and they're working on a new policy. And the methods that they are planning on deploying really kind of makes our project a little bit defunct in its current form. They are looking at developing a universal approach that will identify all children with reading difficulties. And then they're going to use a method called precision teaching. Is that right, Anna? Precision teaching that will aim to bring up the level, firstly, identify any children with a delay in their reading, which is a really good indicator for dyslexia and other specific learning difficulties. And then look at bringing the level of that child reading up through precision teaching, which is a specific method that they would be hoping to teach all teachers in Blackpool. And those children who don't respond to that precision teaching could possibly have dyslexia, and then there's lots of evidence to suggest that this is a much more effective dyslexia screening method than the traditional ones. So whilst our intervention was aiming at identifying children early, this universal approach is going to pick up all of those children. So our project as it currently stands is no longer required, which is a real disappointment in one way, but in another way it's really good because less children are going to be missed now. So whereas we wouldn't particularly, we would be focusing on all of those children who had an adverse childhood experience and those compounding factors. Now it's a universal approach, so more children will be picked up and more children will get their support earlier, which means that they'll have better outcomes as well. Okay, so throughout the process, obviously it's been a really valuable learning experience for us all. We've got a list on our poster at the back of things that we feel have been important for us. What we would do next time is we would make sure that we had the right people around the table from a very early point in the project. We felt that we had some, well, we had some good people. We've got some brilliant people in our team, but we also needed that input from other people who are key. For example, head teachers and the educational psychologists, which was key. It didn't happen, but if we were to do it again, and if we hadn't have had such a tight timescale, I think that we probably would have got there. And understanding the project direction in the initial stages, this was an evolution for us. I mean, we started in one place and we ended up somewhere very different, and we felt that we used the evidence to shape that, so which is the whole point of the programme. So we think that that was a really useful, I don't like the word journey because it's a bit, but it was a useful journey going from that point to that point and using the evidence to get there. And also, because of the time constraints on our own workloads, we're all really busy. The time for this type of project really does need to be safeguarded. It's all right, your manager agreeing to 2 days a month, but then when you've got other pressures, that 2 days a month kind of dwindles and dwindles and dwindles because, but obviously, I mean, this type of event, I hope we're getting across, well, I hope we're going to get across how valuable it is and how important it is for group learning. It needs to be shared with our colleagues, really. Okay, we've also got a much greater understanding of each other's work. We've got myself in public health, I've got the PRU, we've got youth offending team and careers advisor, and I personally did not know how much input into health the other team members had, really. And now we can work together much more effectively because we've got a much greater understanding, really. And also, driving change is very difficult. And we need, as I said earlier, we need the correct people around the table as early as possible. And if they can't commit to being part of the team, they at least need to have an input and be able to make those, help us with that change and influence the right people for us. And we've all got a much better understanding of how important it is to have really effective evidence-based collaboration to achieve better outcomes for young people in Blackpool. And individually, we've benefited from the the workshops around searching for evidence and informing practice, and also differentiating between good and bad evidence. Just because it's in a peer-reviewed journal does not mean it is any good. Well, you know, it's probably good, but there are maybe better ways to look at it. Understanding change and how to influence organisational culture, that was a really important thing for us. That we felt that was a really valuable part of the process. And quite often we are blinkered in our work and we've got a single-minded focus, we need to do this, but you've got to look at who are the key people you need to influence, where are they starting from, and where do you need to get them to be in terms of your project. And we also, the team members have also got a much better understanding of health inequalities and how it affects their work, which I think is really key. So the future, although the project didn't work entirely, in its entirety, we feel as though this is just really the initial stage of the project. We're definitely going to move it forward. The road to, this is another corny one, but the road to enlightenment is long and difficult. We've hit a couple of potholes, but at least we're on the road. So we're on the road and the journey is being made, and we will get there in the end. We've got, we need to consider academies, obviously, but we're also going to be working with the educational psychologists as part of their specific learning difficulty steering group, which will be key to make sure that obviously the PRU will be invited to that. They will invite, because obviously they wouldn't be able to work it without you. But also they might not have had health represented on that board before, because for them the goal is the education side of it. Whereas I think if you've got public health representation, then it's going to make it a much more holistic approach, which I think will be better for the young people ultimately. And also we're looking at, Leslie's put us in touch with quite a few other people who we could do future research with. We've got a meeting arranged with the Reader organisation, which are a really good organisation that look at bibliotherapy through reading for people with mental health problems, and they do lots of research around reading and the value of reading and literacy. And that is that.
Well, I think the teams have done a stunning job. They've done all of the things that we asked them to do. The history of the Clark is that it has to deal with health inequalities, and there has to be public engagement, and that's happened across the themes. It's identified some challenges in all of that, but actually it has all grown. The teams have done things like patient and public involvement in different ways. We can't judge that as successful or not successful. It worked for their teams and worked very well for their teams. So it's really contributed to the work of the Clark in terms of looking at health inequalities, patient engagement, and changing practice to improve the population's health.